Welcome everyone to this presentation, Hair Loss Post-COVID, the Residual Effects from COVID-19 and How to Treat Them. I'm Dr. Nirvana Gabala. I'm a naturopathic doctor and a women's health expert. I also have a master's in clinical mental health counseling. Now, this, as you can imagine, is a huge hot topic and we're still right in the middle of it. There are things that we've learned and things that are still unknown. So this presentation will cover the most current and up-to-date research and information that is being shared in the medical community. But first, I have to, just fixing some kinks here. Okay, first I want to talk about what this presentation is going to cover. We're going to talk about what we've learned thus far about SARS-CoV-2. We're going to understand the reasoning behind residual symptoms of COVID, why it's important to know what those residual symptoms are. I'm going to be talking about hair loss during and after COVID and the vaccine, the research on possible effective treatment options that we and our patients can utilize, prevention and treatment. And finally, I'll be talking about, where do we go from here? What is our future looking like after this pandemic? But first, I have to share what propelled me to pursue such an endeavor to address all of you today. And that's my own experiences with patients that exploded to actually similar occurrences of thousands of other people, men and women alike. Now, as a women's health expert, I primarily help women with hormonal imbalances, so those with PCOS or hypo or hyperthyroid disease, GI issues, mental emotional illnesses. And most women who come to me seek me out to help with their hair loss issues. It's usually the undeniable physical symptom that's hard for them to ignore. And, nothing else has worked in the conventional medical realm. So they seek natural resources. Now, I created a program called the Luscious Locks System to help these women who suffer from hormonal imbalances regain their confidence and power and take control of their bodies when their often most debilitating symptom is hair loss. And I have joined several hair loss support groups on Facebook and other social media platforms so that I can better identify, where my patients and my future patients are really coming from, what their most distressful part of their hair loss situation really is, and what they're really going through to better understand them. But being a part of these support groups, I noticed that more and more women were talking about hair loss being more common after getting COVID or after getting vaccinated. And these are from women who were joining these support groups, not having any kind of hormonal imbalances, in their past medical history. There's some support groups, for women who have low ferritin and, low iron and low vitamin D, and that could be the cause of their hair loss. But these were women who were joining these support groups because they just had COVID or they had just taken the vaccine and they were noticing these changes. So besides hair loss, there are residual effects. There's loss of taste, there's loss of smell, exacerbated anxiety and depression, irregular menstrual cycles, brain fog, and musculoskeletal pain. But because of just my area of expertise, I'm focusing on hair loss, but we have to remember that the residual effects span much further than just hair loss. And these are, lingering symptoms that can last, months after having COVID or months after being vaccinated. So let's go back to the support group. So, these support groups of women who've had, low ferritin or low vitamin D were, talking about hair loss due to that. There started popping up support groups that were specific to just having COVID and noticing hair loss from COVID. And, some of these women were saying, and it's back, hate this roller coaster. Did anyone notice a shed after their COVID vaccination? I noticed things got worse after each vaccine. I was able to get storage in between them, but even the regrowth is falling out. Another woman said, hi, I'm suffering from severe hair loss post-COVID, around 250 to 300 hair on wash day. On other days, hair keeps shedding. Has anyone experienced the same and can I recommend what helped? So these are women who, they've kind of reached the end of their rope. They're desperate. They're fearful. They don't know, why they're having so much hair loss after having COVID or being vaccinated. And they need support and help, from people who have gone through the same thing. Another woman said, I had COVID in December and my hair started falling out in February, March. It's all over loss, not just top or crown. It's still falling out and it's even getting worse the last 2 to 3 months. Another woman said, well, just love the dermatologist and he confirmed what I already knew with having both AGA and TE. He was so nice about it, told me it was a classic case of TE from COVID, which jump-started my AGA to make it worse. Another woman said, I started losing my hair 2 weeks after my second COVID vaccine. It lasted for 2 months and slowed down. I ended up losing almost 75% of my hair. I can't believe how much hair I've lost in a month. I would never have guessed COVID would do this, but COVID has pretty much wrecked my body. I'm thankful to be alive. And she also said, my freaking hair is turning gray now. I lost a ton of hair during COVID and right after COVID. I feel like I'm losing less and less. I'm currently 40 days post-positive test. I feel fine otherwise. So yeah, these are, actual people with, actual experiences of having COVID or being vaccinated with hair loss issues. Now, this is a short video of what the hair growth cycle is and what exactly happens when, more and more people are noticing hair loss due to the vaccine or COVID. So generally, we start with the anagen phase. The anagen phase here is the green shaded circle. It's the growth phase, and then we go into the catagen phase and then the telogen phase. The catagen phase is the dying phase, and then the telogen phase is the resting phase. Now, as we see, the telogen phase, which is the light gray area, is becoming wider and wider. The anagen, which is the green phase, is becoming less and less, which means that in telogen effluvium, which is the side effect of having COVID and or the vaccine, which is causing the hair loss, TE is the prolonged process of hair life cycle in the shedding phase. Hair is usually 90% of its time in the growth phase, which is the anagen phase, and only 10% in the telogen phase. But in times of high fever, during an infection or illness, like having COVID, or in giving birth, like a hormonal imbalance, weight loss, medication, or stopping oral contraceptives, other changes in hormones, the hair cycle spends up to 20% of its life in telogen. And in this video, we saw that the hair was getting thinner and thinner. It was getting more and more detached from the root and from the surface, making it more easily to fall out. Which is why, these women were seeing a more profound change in their hair and in their hair loss. But let me backtrack here. So there are residual effects like hair loss due to COVID or the vaccine. Why is this important though? This is important because it draws a picture for us to continue learning about SARS-CoV-2. What the virus leaves behind is actually a canvas of what it is. It's a novel virus, and we can start learning about how it compares to its cousins like SARS or MERS or the Delta and Alpha variants. And when we have a canvas, the virus's picture and true colors, we can see the bigger picture. And the bigger picture is how do we treat and what to target. So all of the residual effects of COVID have to be addressed and brought to light. It has to be investigated. Now, again, I'm just bringing up the hair loss part just because that's my area of expertise. But we need to really address and bring to light all these other residual effects of the COVID and of the vaccine. Now, the good thing is, enough anecdotes are evidence whether Big Pharma or government acknowledges that or not. Those stories of women experiencing hair loss, this is enough for us to say this is evidence, that COVID or the vaccines having these, is causing, these symptoms. Another good thing is that the Biden administration last month recognized this, but more specifically when it came to reproductive health. So NIH was awarded $1.67 million to 5 institutions who will be conducting studies consisting of 400,000 to 500,000 participants on the effect of the vaccine on reproductive health. Now, even though this study is only going to talk about the effect of the vaccine, we can imply, when we're just reading the study in the future, that the same kinds of results would be from having COVID itself and not just from the vaccine. So this is a wonderful first step in the right direction. We want more investigation as to what the vaccine is really doing in our bodies and what COVID can do. Unfortunately, results of these studies won't be available until the end of 2022 or possibly even later. But here's what I can tell you now and probably what the studies will show based on what we found right now. So we know that the entry and fusion of SARS-CoV-2 is through spike proteins, which bind to ACE2 receptors of the host cell. The ACE2 receptors are commonly found in vascular endothelial tissue like the heart, lungs, and also in endothelial cells of the kidney, the mucosal membranes of the nose and mouth and GI tract, the testes and prostate, and even the placental membrane. Now that's important too, because when we hear of people who've had COVID and had a miscarriage, or people who've taken the vaccine and had a miscarriage, this may be why. So the diseases common with COVID pertain to these organs that have the most ACE2 receptors. But according to a new study by the Salk Institute, researchers found that the real danger is in fact the spike protein. And what the research did is create, sorry, that's a little bit too fast. What the researchers did is create a pseudovirus that had these spike proteins on its membrane, but did not actually contain a virus. So it was basically an empty, it was basically a shell or a membrane of these spike proteins with nothing inside. And they named it a pseudovirus. Exposure of the host cell to the pseudovirus resulted in damage to the vascular endothelium that we see with SARS-CoV-2, proving that the spike protein alone was enough to cause disease. The virus itself was what was responsible for the replication of itself, but the spike protein is what actually caused that inflammatory processes. Now, with mRNA vaccines like the Moderna vaccine and the Pfizer vaccine, the mRNA is introduced into the host body's muscle cell, usually through the deltoid, where it makes copies of the spike protein. So as long as spike proteins are present, there will be some sort of inflammatory endothelial interaction. And now we can go to the slide. So here's another study about how we can actually block the interaction between ACE2 cell surface receptors and the SARS-CoV-2 spike protein, and it's through the use of dandelion tea. And what this tells us is we already have the tools we need to beat COVID and other future pandemic-causing microbes. The important thing is, which tools should we use? Okay, because there are a lot of things, a lot of modalities that we can use, a lot of supplements that we can prescribe, for inflammation and to boost immunity. But really, what are those best modalities that we can utilize in our toolbox that will yield the best results for us and our patients? Now, that is the biggest question. In another study, the SARS coronavirus papain-like protease structure and function inhibition by design antiviral compounds. The research notes that zinc and zinc conjugates have been shown to inhibit PL-pro protease activity. PL-pro protease is essential for coronavirus replication, but it's also one of the ways the virus evades the host innate immune response. And that's important because we know that the host innate immune response is what is inhibited when it comes to coronavirus. And it does that by inhibiting the dysregulation of signaling cascades in infected cells that may lead to cell death in surrounding uninfected cells. So zinc is a powerful mineral to include in our arsenal. Now, we didn't need this study to tell us that, right? We already know that zinc's antiviral functions, are there. We also know that loss of taste can be due to a zinc deficiency. So zinc would have been in our toolbox anyway. And by replenishing zinc reserves, we can actually observe if the residual symptoms like loss of taste are resolved. So we already have what we need to prevent and treat COVID. The question really is what do we use? And my answer to that heavily lies in my experiences as a naturopathic doctor. So here's, a little bit about me. I did a preceptorship and externship at Cancer Treatment Centers of America. And there I witnessed an integrative model of care of a cancer patient that consisted of a medical oncologist, a naturopathic physician, a nutritionist, and a case manager. I saw firsthand the importance of the physiological terrain left over from conventional treatment like chemotherapy and radiation, and the importance of improving it so cancer doesn't return like a force to be reckoned with. In fact, the remission state, when other doctors would just wait and see if the cancer returns, this is where naturopathic medicine shines. It's one of the places. But yeah, our terrain, our physiological terrain, basically what is left over is what we can work on, what we can strengthen so that we can prevent disease or we can prevent cancer from coming back. So that was an important thing that I learned when I did some time there. I also studied under Dr. Andre Saint, a well-renowned homeopath in Montreal. I'm sure that you're all well aware, the founder of homeopathy, Samuel Hahnemann, wrote the Organon of Medicine. And that's important too because he didn't write the Organon of homeopathy. Homeopathy alone is not, true medicine. We need a combination of, I believe, homeopathy, lifestyle medicine, emotional and mental well-being, which is all meant to increase vitality in a person's constitution, which is vital. So in this case, when we're talking about modalities to treat COVID or the effects of a COVID vaccine, we need to really look at modalities that will increase a person's vitality and constitution, to remove them from a state of disease, to be able to get them to heal themselves, without the need of something from the outside to heal them all the time. I also worked in True North Health Clinic, which is in Santa Rosa, California. And there, water fasting was the main mode of treatment for patients. I've seen patients who go anywhere from 5 days of water fasting to 30 days of water fasting. I myself have gone on 11 days of water fasting. And this has been shown to have significant positive results in patients battling all spectrums of disease from IBS, diabetes, to even cancer. Now, this is where I dive deep into the importance of natural hygiene and health and well-being, and I'll talk more about natural hygiene a few slides down. And then finally, my experience working in Dubai. I lived in the very first sustainable city in Dubai, the UAE, and I worked in a clinic that really focused on sustainable health, which is basically how your environment impacts your health and how your health impacts your environment. So in Sustainable City, a little bit about it. It's a city engineered to be 100% self-sufficient and self-reliant. It is 100% carbon emission free, contains biodomes, which are those circle things you see in the picture here. That's where fruit and vegetables can be grown, because Dubai, the UAE, is a desert. The weathers don't permit for growth of just any kind of vegetable or fruit. And the purpose of the biodomes and the purpose of growing fruit and vegetables in the city is to be able to feed all the constituents living in the city and whatever is left over to sell to other people in other cities. It also has zero net service charges, as you can see from all the solar panels on the roofs. And with that, I worked in a clinic and was introduced to sustainable health, like I was saying, and really understanding the impact that our environment really has on our bodies. And when we're living healthy, we tend to see an environment around us that is also thriving and healthy. Now, this is important too, because we know that coronaviruses are of zoonotic origin. Sustainable health is going to be a pivotal component to consider when looking at health and wellness, especially in the future. And I actually predict the future of medicine will be centered around sustainable health. And we'll see more and more titles of like sustainable medical expert or sustainable doctor or something to that effect. But, in all honesty, naturopathic doctors are very close to being sustainable doctors anyway, especially those who practice natural hygiene. So in present time, when we're looking for a full picture approach to treating COVID or any other pandemic causing microbe, increasing our vitality and our patient's vitality is key. And we need to look for ways in which treatment can be discontinued, but positive effects continue stacking up. For example, we can give supplementation, but if we need to continue being supplemented to be protected, and if we lose that protection when we stop supplementation, that is not ideal treatment. That is not what we need. That is not what our philosophy, our naturopathic philosophy tells us to practice medicine. Our philosophy is about having the body be strengthened enough to be able to heal itself and protect itself. And, I've talked about the luscious lock system, and this is what I use with my patients, is this approach, the philosophy for optimal health, and that is eliminating, replenishing, and strengthening your vitality. And we do that through the INV formula. So we eliminate the insult and work on decreasing inflammation. And we increase nutrition to feed the body what it hungers for to heal, whilst also decreasing inflammation. And we increase vitality through the use of homeopathy and natural hygiene. So natural hygiene, I've mentioned it before. It's basically the way we restore and preserve health by things that affect our life directly. So practicing natural hygiene, is being mindful of the foods we eat, the water we drink, how much sunshine and sleep we get, the stress and toxin reduction, in our lives, and having positive social relationships, using what is around us to heal us. Hydrotherapy, is a type of natural hygiene because you're using water, which you can find in a river, in a well. It doesn't have to be a special water or anything. It's easily accessible to, most of us in the world. That is part of natural hygiene. That is a modality that we should be using. Water fasting. Fasting is, you just stop eating, especially when you're very sick. It's another modality that we can be using. All right, so we'll talk about homeopathy first. And this is, a way for us to increase our vitality and constitution. And the strongest piece of evidence we have on homeopathy in pandemics are statistics on how homeopathy fared in treatment compared to the conventional treatment during the Spanish flu. And this was taken from Dr. Andre Sain's presentation on April 4th of 2020 on case management of the influenza and pneumonia patient with homeopathy during the COVID-19 pandemic. He had done extensive research, and he put together all of his research into tables, and this is one of the tables that he presented on, and is basically the odds of surviving the combined effects of influenza and pneumonia under conventional medical care and homeopathy during the 1918-1920 influenza pandemic, which is the Spanish flu. So we see here the conventional medical care in the U.S. Armed Forces was 16-1, meaning surviving rate was 16-1. Homeopathy in the general population was 148-1. That's a big difference. Conventional medical care in pregnant women, 2-1. So pregnant women are more susceptible to these pandemic viruses. Homeopathy in pregnant women, 135-1. Another significant difference. And we can see that homeopathy does have a huge role to play when it comes to treating people during pandemic times. Now, what he also presented on were common homeopathic remedies that were seen to have a positive effect and to decrease the length of time of debilitation. And he noted 60% of COVID patients have responded to bryonia, and bryonia would be indicated in a person with loss of smell and taste, better from staying still, and worse with movement. Bryonia also seems to be the best remedy for prevention and to address the early symptoms of COVID-19, like dry cough, fever, fatigue, muscle aches, chest depression, shortness of breath, and so on. Other remedies that were shown to have positive effects were like arsenicum, pulsatilla, lycopodium, and so on. Gelsemium was also a common remedy used, especially for those patients who were typically thirstless during all the phases of the flu. So this is a important thing to note. If the patient oftentimes has a dry mouth without thirst, gelsemium would be indicated. Another thing to note here is that if you are practicing homeopath or a naturopath who uses homeopathy often or has some knowledge of the materia medica, a person's chronic remedy is oftentimes the acute remedy during COVID-19 infection. So another thing, natural hygiene is water fasting. Water fasting, especially during times of fever, very, very effective. We say starve a fever, feed a cold, right? Antipyretics can cause the virus to replicate more easily than at elevated body temperature. So we want to avoid antipyretics as much as possible. Hydrotherapy is something else that I talked about. Hydrotherapy, both short, cold, and heat, will increase WBC migration and immune response. Temperature differences between hot and cold should be as great as possible. So the hottest hot and the coldest cold a patient can handle will yield the best results when it comes to using hydrotherapy as a modality. Using constitutional hydrotherapy, which is a treatment utilizing hot and cold towels coupled with electrical stimulation, is good, especially when combating cold or flu-like symptoms. And then wet sock treatment, which we focus on the feet because those are reflex areas for the upper respiratory tract and lungs. Now, according to Boyle and Sane in their hydrotherapy book, a mild fever is between 99 to 103. And in this case, you want to produce an artificial fever using hot bath or hot blankets. So you actually want to promote more heat. A moderate fever, which is between 103 and 105, you want to use short hot treatments, which is usually around 5 to 10 minutes, or min friction to reduce chilliness and initiate heat dissipation. And then a high fever, which is 106 and greater, that's when you actually want to start reducing temperature. So you can use tepid baths and cool compresses. And always, always hydrate, and always when you're doing hydrotherapy, and with a cold treatment. Now, another thing that I had mentioned before was how SARS-CoV-2 affects the host innate immune system, which is basically affecting natural killer cells in our bodies. And in this study, it talks about activation of natural killer cells by probiotics. And here they say certain strains of probiotics have been seen to enhance innate immunity, which is what we're looking for, the innate, not acquired immunity. But probiotics do not appear to have much of a desired effect on acquired immunity. NK cells are part of the innate immune system and are known for the cytokine secretion and killing of virally infected and tumor cells. Hence, NK cells protect the host from pathogens and transform cells by their targeted elimination. And the reason I include probiotics and this in as one of our key modalities in treating COVID and side effects of the vaccine is because probiotics is also something that should not be taken long term. You want to help the body build up its good flora, but it's not something that you should be on, for the rest of your life. And when you've reached a place of, your body actually having good flora, that's when you stop taking probiotics. And then you can maintain that, with just your diet. You can eat fermented foods and all of that. But so this is something that when you stop, you don't have to keep taking to have the same positive effects of being on it. Now, the last thing that I'm going to talk about is muscle strength. And I included this in this presentation as well as one of the modalities that we can use, like weight training, because of this study. Muscle strength and muscle mass as predictors of hospital length of stay in patients with moderate to severe COVID-19. Their conclusion was muscle strength and mass assessed upon hospital admission are predictors of length of stay in patients with moderate to severe COVID-19, which stresses the value of muscle health and prognosis of the disease. So in the study, they've actually were able to see that patients who had greater muscle strength and mass, especially grip strength, had a lesser time of being debilitated and being in the hospital. And that's a huge thing to consider too, especially when we're talking about natural hygiene, what we can do. We can, increase our muscle strength. We can, do weight training. These are, of course, have humongous benefits to us when we're talking about our overall health. So our future here, when we're really thinking about how to treat COVID or the residual effects of the vaccine, is, of course, one of our philosophies is prevention. Prevention is very important. It's quite easier to prevent the disease than to cure it. But we also need to think about, that sustainability. We need better and humane farming practices. If we can eat more whole foods, plant-based, that's even better. And we need to work on our natural immunity to survive future pandemics because there will be more and they will be more severe than this. So we are looking at more lockdowns and more quarantine time in our future. And, diseases and viruses that are faster and quicker to infect. So the virulence is going to be much greater and the mortality is going to be much greater. And then we need to really think about vaccines. Do they create more pandemics? Are they really helping us increase our immune system's ability to fight off future infections? That's, I mean, we all have our own opinions about this, about whether vaccines are good or not. The research needs to be done, unbiased, hopefully. We do live in a propaganda-censored world, no matter the kinds of freedoms we have, there is still propaganda and censorship around us. But we need to be educated consumers of information at all times, no matter what. And we really need to think about what is coming out, what is being presented to us, what is being offered to us as a solution, if that's actually going to be helping us, helping our immune systems get stronger or not. So those are things to consider. And now I open this up to questions.